1,000 people have died on the continent, and that results in a case fatality rate of 2.5%. So again, just keep in mind that the global case fatality rate is now 2.2%, and the continental case fatality rate is 2.5%. That is a significant difference. 5 countries that account for about 70% of the cases of COVID on the continent include South Africa with about 41%, Morocco 13%, Tunisia 6%, Egypt 5%, and Ethiopia 4%. And let me just come back to the fatality rate. That's the number of people dying. 21 countries, that is 38% of the countries in Africa, are now reporting case fatality rates greater than the global average of 2.2%. And it is of the 21 countries, 14 of them are reporting case fatality rates of more than 3%. They range from 3% to about 15.4%. That's a very high rate of case fatality rate that we are beginning to see on the continent. If you look at the epidemiological trends over the last week, that is the week 3, that spans from January 18 to January 24th, we noticed that we've recorded 174,000 new cases of COVID-19 and 6,200 new deaths. This represents, for the number of cases, represents a 17% decrease. And we'll come back to that and explain that decrease, because it's essentially influenced by South Africa, but an increase of 2% deaths, respectively. The highest proportion of new cases reported for the week was from Southern African region, representing 62%, followed by Northern Africa, 20%, West Africa, 12%, East Africa, 4%, and Central Africa, 2%. 5 African countries reporting the highest number of new cases are South Africa, 75,000 cases, Tunisia, 16,000, Nigeria, 11,000, Zambia, 7,000, and Malawi, 6,900. In terms of trends, if you now look at the 4 weeks period, and that spans the period between December 28th and January 24th, we notice that overall we have seen an increase of 4% of new cases. And by region, they read as follows: 9% decrease in East Africa, 4% decrease in North Africa, 16% increase in Central Africa, 7% increase in Southern Africa, and 21% increase in West Africa. Over the last 4 epidemiological weeks, we have noted the following trends for the most populous countries in Africa. Nigeria, 20% average increase. South Africa, 1% average increase. Ethiopia, 4% average decrease. Egypt, 4% average decrease. DRC, 6% average decrease. And Kenya, 5% average decrease. In terms of deaths, these are new deaths. Ethiopia has recorded a 9% average decrease. Kenya, 5% average decrease. Nigeria, 33% average increase. DRC, 26% average increase. South Africa, 18% average increase. Egypt, 3% average increase. In terms of the testing, as a continent, we have now conducted about 30 million COVID tests. And the 10 countries that are reporting more than 70% of the testing include South Africa, Morocco, Ethiopia, Nigeria, Kenya, Egypt, Zambia, Rwanda, Tunisia, and Uganda. In the past week, Africa CDC has procured additional 700 oxygen concentrators and accompanying accessories, 140 pulse oximeters, and 55 handheld ultrasound oxygen analyzers for distribution to member states. This is so important because a lot of the mortality that we are seeing is because of very basic lack of oxygen in healthcare centers and hospitals. So we are focusing and shifting our strategy to that to make sure that we support member states to increase their ability to access oxygen. We have also committed 13 million antigen tests, and of these, 8.3 million have been procured and being distributed to member states already. A total of 104,000 antigen tests were also donated by the Canadian government to support the following countries: DR Congo, Niger, Burkina Faso, Congo, Sierra Leone, and they will all get this test by the end of this week. In terms of other areas of capacity building, we have now trained 1,200 laboratory professionals from 14 member states on antigen tests, and 488 laboratories from 44 member states are now participating in quality assurance for COVID testing, we are very excited with that because it will continue to enhance and strengthen the quality management systems and the outcomes of the results that we produce. Let me just conclude with the vaccine area. Yesterday, we had a very successful and productive meeting convened by His Excellency Cyril Ramaphosa in his capacity as the chair of the African Union. It was attended by very high-level personalities, including the chair of the African Union Commission, His Excellency Musa Faki Mahamat, Dr. Tedros, the Director General of WHO, the President of the World Bank, David Malpass, the UN Secretary General, Antonio Guterres, sent in a recorded message. Several ministers were also on the platform, the CEO of Gavi, Dr. Seth Berkley, and a whole range of other personalities. In addition to that, the AU special envoys, the Strive Masiwa, Benedict Orama from the Afri-Exim Bank, Donna Kaberuka, and others participated. And overall, the participants, if I recorded correctly, were about 200 across Africa and the world. There were two key issues that were discussed yesterday. One was financing of the vaccines. And Afri-Exim Bank again announced that they are committed up to $2 billion to support member states that were interested in working through the AVAC mechanism. AVAC is the African Vaccine Acquisition Task Team that was set up by the chair of the union, His Excellency Cyril Ramaphosa. So the financing is available to member states. We have now issued note verbals and with forms to member states so that they can begin to send in their requests to express their interest on the vaccines that they will need. If you go to the platform, that is the ASMP.Africa, that is our distribution platform, you see the various allocations of vaccines that have been assigned to countries. And there's a deadline that has been given to countries to express their interest so that they can start engaging with the Afri-Exim Bank to move the process forward, and then, of course, with the distribution. I think that was a very successful meeting. From that meeting, an important announcement was made by the chair of the union, His Excellency Cyril Ramaphosa, where he made known that the MTN company, the phone company, had donated $25 million to assist the AVAC process that is the African Vaccine Acquisition Task Team, to procure vaccines enough to vaccinate at least all of our healthcare workers on the continent. As we speak, as a continent, we currently have about 3 million healthcare workers. So we are targeting that that money will be used in procuring enough vaccines to vaccinate all of those healthcare workers, including the cost of transportation and the cost of part of the cost of training. And that is a partnership between MTN and Africa CDC, the African Union Commission. We will sign in an MOU with them. That's a great initiative. It speaks to the power of partnership and what the private sector can do, step up to the plate and do that. We call on other parties, other private sector to step up and work with us so that we can continue to fight this pandemic, especially with vaccines. Targeting healthcare workers is very strategic and at the same time tactical, because they are bearing the brunt of the pandemic now, especially in the second wave that you heard in the statistics I provided earlier, is more aggressive. Mortality is more severe than we observed in the first wave. And I think it is fair to say that at least now on the continent, we now know, everybody knows at least one or two people that have died because of COVID, if not more. During the first wave, it was a little bit difficult for people to point to that, but I have the belief now that we have seen family members, loved ones, and friends that have succumbed. I think I've personally seen colleagues that have really died just this past week. Two of the colleagues that I've worked very closely over my career died in Zimbabwe. Professor James Hacking, who is a renowned public health expert, researcher, passed away. And Professor David Kazakhstan, that I worked with for many years, more than 25 years, on HIV drug-resistant issues, that also passed away. He was a professor at the Stanford University, but did a lot of work in Zimbabwe, and actually has worked in Zimbabwe extensively. So we all know this thing now very personal. It's not longer something that we are speculating. So I say this to say that the best way to prevent death would be to scale up vaccination very, very quickly so that we prevent people from even catching the disease. The second part of the conversation yesterday was focused on the delivery of vaccines. What kind of partnerships are important? What kind of guidelines were important? At that point, the regional director of WHO, Dr. Moeti, took the session, coordinated the session with Professor Helen Rees, and they actually laid out the plans that the continent have put in place, both with guidance from the World Health Organization and from the Africa CDC. We are working with the countries extensively to build the capacity that is required in the areas of transportation of vaccines, storage of vaccines, training, establishing vaccination centers, and of course, managing the waste and also tracking people that have been vaccinated so that they can come back and receive their second dose. Vaccination on the continent of the size of Africa, which is a continent of 1.2 billion people, will be a historic effort that has never been observed in the history or since Africa became independent, since 1960. So this is a historical effort that will require all kinds of partnership with the community, partnership with the private sector, partnership with the traditional donors, and partnership, of course, with the whole of society approach so that we can do this quick. In order to be successful, we need to achieve a 60% target within 2 years. If we do not do that, then COVID becomes endemic on the continent. I think that is extremely important. So that discussion is so tools were launched. We rolled out a tool for what we call an implementation guide to support countries to begin their vaccination programs. As you have heard probably in the news, COVAX also announced yesterday that they will raise the doses. They have secured enough doses that are now exceeding the 20% that they had previously stated for the continent to about 27%. We are grateful for that. We, as AVAC, continues to explore additional doses of vaccines. We heard also yesterday from the coordinator of AVAC, Mr. Strife Masiwa, that an additional 400 million doses of vaccines have been secured through the Serum Institute. So if you add the 400 million doses to the 270 million doses, I think we are beginning to make very, very good progress. Let me just conclude by saying that we are very pleased that Kenya has now adopted the Africa CDC Trusted Travel Portal to verify COVID laboratory tests for passengers. I think that is a very much welcome initiative. We strongly urge other countries to follow through. We have been working on this initiative since October, and I'm pleased that Kenya has taken the lead on this. At this point, I would like to acknowledge the strong partnership between Panabaus and the EcoNet that have been working with us very quietly in a sustained manner to enable us to get to where we are. Africa CDC is also working with the Tony Blair Institute and the IATA to enhance the technical operations and integration of the several platforms so that we can have a coordinated and standardized platform to monitor trusted testing across the country. Thank you, Wayne, and back to you.
Thank you very much. Sent in a number of questions, but for now, I'll give you the first two. So he says, initially, it was anticipated that nearly 250 million people across Africa will catch the coronavirus during the first year of the pandemic, and that up to 190,000 of them will most likely die. But it looks like this has not been the case. So the question is, what is the possible explanation for this? Then the second question, why should Africa take the vaccine, yet it is the least affected continent? So those are the two questions, the first two questions from Silence Mugadzaweta.
I think Silence is asking very tough questions this morning. And I think the first question is really a question that we all have been trying to explain for the last couple of months. I think we know that during the first wave of the pandemic, we were not affected the way that it was projected, and this is thanks to a concerted effort across the continent, efforts led by our head of states, efforts led by the African Union Commission and Africa CDC and WHO in coordinating activities across the board. If you recall, Silence, that when this pandemic just hit Egypt on the 14th of February, the chairperson of the African Union Commission, Chairperson Moussa Faki, convened a meeting here on February 22nd. So at that time, we had only 2 cases on the continent, and ministers of health came. We had a very good discussion and developed a continental strategy, a joint continental strategy. And so ministers left Addis Ababa on the 22nd of February with clarity of actions to take. And when the COVID started showing up on the continent around the last week of February and beginning of March, they did just what we had agreed to do. Your country, Zimbabwe, actually took extra measures. They declared a state of emergency where there was no COVID case at that time. So those early measures helped to blunt the virus clearly. If you take a country like South Africa, if they hadn't gone into a quick lockdown where they only had 70-something cases in that country, their pandemic would have been where the UK is today. Okay, but because they were doubling every 2 days. So because of that, it stretched that doubling time there. So I think we should always remember that the leadership of the continent, with strong coordination from your public health agency, the Africa CDC, WHO, and with strong leadership from the countries made a difference. Let me just end there by saying that those were projections, and it didn't say that we must die. They said that if the virus spread the way that we saw it spreading in China, Europe at that time, that is what is going to happen. But it was up to our ability to blunt it, and which we did. We are not yet out of the wood, because if you look at our first pandemic, it was relatively mild. The second pandemic, the second wave of the pandemic is very aggressive now. At the peak of the first wave, as a continent, we were recording just about 16,000 cases, 16 to 18,000 cases a day. And now we are recording more than 32,000 cases of COVID-19 on a daily basis, and we've not yet peaked. So again, let's not be complacent. We are not yet out of the wood at all. The second question, why Africa should be having vaccines, again, it speaks to the epidemiological data that I presented earlier today. Our numbers are increasing. Remember last year, we were still talking about numbers that were lower than 500,000 or 1 million. Today, we are close to 3.5 million cases. Our death rates is increasing. As I said earlier, just between last week and this week, we are seeing increases in death rates across the continent. So the only way that we prevent the death, our own people from dying, our loved ones from dying, is to vaccinate ourselves. So we are all vulnerable and susceptible. So the only way that we do that is to get the vaccine so that we protect ourselves and protect our loved ones.
Will countries cover foreigners in vaccination? If not, will that not affect the 60% herd immunity? Then the second question, since immunity takes about 6 weeks after the first shot, what are the consequences if the vaccinated person contracts COVID-19 during that period? Does it not disturb the whole process? So those are two questions from...
So with respect to the first question, there cannot be discrimination of people who are living within that in any given country. So those vaccines, there should be equitable access to anyone living in the national territory. I think that is our position. Cannot discriminate against COVID vaccines. Then it will defeat the whole vaccination program. The virus doesn't know who is a foreigner and who is a national. So the virus seeks to infect anyone that they meet in their way. So I think that is extremely important that we know that and not even encourage that. So I'll probably just say that we should actually condemn any country that is trying to segregate people that they will vaccinate with respect to their national origin. When you talk of the vaccines are not a magic bullet. And I'll explain that we continue to enhance our public health measures as much as possible, because from the time you get someone vaccinated to the time that immune system, your white blood cells are completely activated and ready to fight an incoming virus, you may still be infected. Okay, that is, we are seeing studies in Israel now. Israel has vaccinated the most number of people. That even after the first shot, people have become very, very protected. I think, that was very encouraging. However, there was a small number of people, like 0.01% of people that even after their first shot were infected. But the good thing is that they are infected, but they do not get sick and die, because the vaccine, remember, doesn't actually prevent the infection, but prevents the disease. Prevents you from developing disease. So that is very good news that we are yet seeing from Israel. Now, the second part of that program in Israel is teaching us that if you take your 2 doses of vaccines, it actually decreases significantly any chances that you can be vaccinated, that you can be infected. And I think, again, very good news from Israel. It even shows that the vaccines that they are administering there, the Pfizer vaccine, may actually, in real life, the performance may be better than what the clinical trials showed. I think I was very encouraged to read those early studies coming back from Israel. So the point there is that people should adhere to having, if the vaccine is a 2-dose vaccine, we should all strive to do it exactly the way it is prescribed. That is, you get your first dose. If you are required to come back after 4 weeks, you must come back after 4 weeks to get the second dose.
The next two questions coming from Addis Getachew, and Addis is with Anadolu. The first question, he says, there have been rumors as of late of counterfeit vaccines coming into the continent, particularly from China. Do you have information pointing to that? And if so, how could you prevent such an undesirable phenomenon? So that is one. The second, do you think the March schedule to commence administering mass vaccinations is still realistic, despite the many efforts that you have been making? So those are two questions from Addis.
So Addis, we have not seen or heard of the counterfeit vaccines. But what we have done is really to put in place a mechanism that will help the continent to regulate vaccines. I think we have now established a task force, and a communique will be issued today to that effect. And please go to our website and see that communique, which essentially says that we have a task force that cuts across AU, NEPAD, and WHO and the Africa CDC that will facilitate and streamline the process for reviewing the dossiers and ensuring that the vaccines are safe and efficacious, so that countries don't need to do it on the one-by-one basis, that is country-to-country basis. That mechanism will also enable that, will make it known to the world, so and Africa and vaccine manufacturers. The importance of that is that countries should not feel vulnerable or in the face of this, any new product that anyone brings to them to be tested. If country, say Ethiopia, was approached by a vaccine manufacturer, you now know that you can call Africa CDC and say, look, we have a vaccine manufacturer from country X. Can you take a look at that, the vaccine? And we'll activate that expert review committee to look at the vaccine, the dossiers, and then advise the country appropriately there. We are also working with the REX, the Regional Economic Bloc, so that the dossiers come to us through the expert committee. We review them and share the information with the regional economic blocks, and they can also make decisions at the regional level. All of this in the spirit to fast-track the process. Again, the communique will be issued today. We already have issued guidance on how vaccines should be should be introduced on the continent. So vaccines that go through the WHO process in Geneva, of course, we endorse that. Vaccines that have gone through an appropriate regulatory agency, we look at that. There's guidance on what to do with those. And then vaccines that we know little about, there's also guidance on that. You can go on our website and see that. I say all of this to say that countries are not vulnerable. They know where to go to. We are here. Please do not engage bilaterally with vaccine manufacturers without getting the Africa CDC involved through this task force that we've put in place.
Thank you for that. Let me just remind colleagues who are watching that we now have Portuguese interpretation. So please, those of you who prefer to use Portuguese, you can access it. We have two colleagues who are online, and the first one to put up her hand was Coletta, and Coletta is with FSN. Good morning, Coletta.
Good morning, Wayne.
Good morning. Please go ahead with your question.
Thank you. Dr. John, more countries are currently imposing travel bans and travel advisories against South Africa. I mean, how concerned is the Africa CDC that despite you saying that we don't need to block people from other countries, it's still happening? Then the new strain, how concerned is the Africa CDC about the new strain? Because if we're seeing countries blocking South Africa travel from there, that means other countries are getting more cautious. Then secondly, if you could kindly shed more light about the 400 million extra doses that we're going to get from the Serum Institute of India. Is it under the same package? Will it come this year? And just some more light on that. Thank you.
Thank you, Coletta. These are two or three good questions. With respect to travel across the continent and across the world. Let me be very clear with that. We said very early on that we should go with a COVID testing approach, and that is why we established the trusted travel, you recall, and launched that way back in October. So the rationale behind that is easy, that we should not be banning people because of the geography or the origin, but we should be encouraging people to travel with a negative test and facilitate the testing process so that people can travel with a negative. In other words, if if I were to go to Kenya and I show up at the airport with a valid negative test, I pose no threat to the country of Kenya at that point. So you shouldn't just ban me because I'm coming from a certain country. They should be looking at that test. Is your test valid? And that is why the trusted travel is there. We call on you. This is an area that I really want to partner with the media to work with you so that the continent can really know that this platform is there and work with us. I think it is really for a common interest that everybody knows the process and in a standardized way. We have been working with ministers of health, ministers of transport since October to have this platform. Again, it is on our website. You need to just Google Africa CDC trustedtravel.gov and you see that website there. So again, do not ban people from traveling, but encourage them to, impose that people travel with a negative test. And if we do the negative, we have a common and standardized policy with negative traveling with a negative test, then the issue of being more specific with a variant is off the table, because if you are negative for COVID, you are negative for COVID. I mean, you are not negative for COVID only for certain variants and then positive for that specific variant. A negative test for COVID means you are not infected with COVID, period, COVID-19, and you should be able to travel. So it is our view that and our position that we should have a common dialogue and harmonize that approach very quickly across the continent and again across the world. I think I see countries banning others from traveling to, but that doesn't stop. It doesn't solve the problem. It makes it more difficult. I think again, trusted travel is the way to go with a negative COVID. With respect to the 400 million doses of vaccines, this is a deal that is being concluded with the Serum Institute in India, and it's around the AstraZeneca vaccines. And of course, this will be spread over this year and next year. The challenge we have on our hands now is, as we are seeing now, is that countries must get prepared. Countries must request these doses and through the platform and start the distribution. So the 400 million is in addition to 270 million that was announced. And those deals are being formalized through our special invoices, Mr. Strive Masiwa and Benedict Orama from the Afri-Exim Bank. I don't know if I clarified your question.
Very much, John. We have a question now coming from Rodney Muhumuza of the Associated Press. And Rodney says, could you please talk a bit more about helping African countries improve their capacity with medical oxygen? He recalls calls came last year for more oxygen, but it appears that you are only now starting to ramp up efforts. What are the challenges that you are facing in this regard?
We are facing challenges of local production, and we are not. We're doing a lot as much as possible with different partners. We just had a very good meeting last week with Total that has many stations across all operations in many countries, and they produce a lot of the oxygen. And we have a common understanding working with the World Bank, of course, that they will ramp that production capabilities up as much as possible. Again, we should keep in mind that we are building a ship and riding it. No one last year, so I think today is the 28th of January. In a few days, it will be February 14, the date that the first case of COVID was reported on our continent. The continent was not waiting for COVID. So we are building this capacity as quickly as we fight the war. We are at war with this virus, and we are doing everything possible using all the arms that we have in our armamentarium to fight this battle. And again, there will be the knowns, there will be the unknowns, and there will be surprises as we move on. But it should be remembered that we are building the resilience to continue to fight, anticipate things that will happen, and then move on. A good example is the vaccine. We started vaccine discussions in June 24th and 25th, where we convened a large meeting of over 3,000 participants across the continent, across the world, including the leadership of the continent, His Excellency Musa Faki, and the chair of the union, His Excellency Cyril Ramaphosa. So that was anticipating that. At that time, there was very little talk of vaccines. Now we have vaccines. I think that conversation is carrying forward. I think that is how we anticipate. But there are certain things that we just don't, that will be surprise us, like in battle, and then through our resilience, we'll fight that. A good example is the ventilators. When we started up, the whole discussion was, let's have so many millions of ventilators. But we realized later that, yes, you need ventilators, but you don't probably need as much as that. So we are adjusting our strategy as we're moving forward. You do not suddenly build health systems and need them at the same time. It doesn't work that way. I think you have to build health systems before you need them. And so again, in the post-COVID reconstruction of Africa, in the area of public health, we have to emphasize the ability to produce these interventions locally. That is the oxygen, the vaccines, the drugs, and the diagnostic. But they are not there. We are building it and using it as to fight the pandemic as we go forward.
One is, I wanted to know how many countries in Africa right now have actually began vaccinations. And then two, what vaccines have been approved for use in Africa? What's the process of vaccinations approval? Is it done by the CDC or by individual countries? And then finally, yesterday we saw Tanzania casting doubt on vaccines. Can you comment on that specifically? And more generally, what is the Africa CDC doing to specifically fight doubts about some of these vaccines? Thank you.
Omar, those are very interesting questions. The first question is, I'll be very brief on that and say that Morocco, Egypt, Seychelles, and Guinea have started vaccination. And Guinea is very limited. I think it's just about 50 to 60 vaccinations have occurred. But these other countries have started mainly with the vaccine from China. With respect to the approval process, as I indicated earlier, if you go onto our website now, you see a whole guidance on the approval process for the continent. And just suffice to mention or repeat what I said earlier, that if WHO emergency authorization process has already approved or authorized a vaccine, that is okay for the continent. We'll also be relying on some authoritative regulatory bodies. And we've also set up our own continental mechanism to facilitate that, which again, as I indicated, a press release will go out today and you can see that process. I think, I believe that we are solidly ready. Now, we also need the cooperation of the vaccine manufacturers. In the communique that you read today, you see that we are saying that vaccine manufacturers should share their dossiers with us as soon as possible so that the process is not delayed. So, say, for example, AstraZeneca, Pfizer, and Moderna, if they were to export vaccines to the continent, you send us your dossier. This expert committee will review that. And it's an expert committee that includes national regulatory authorities across the continent and outside the continent. They'll review those and then provide their expert opinion on it. I think that is a process of streamlining. We are in an emergency. We have a pandemic to deal with. So, we cannot approach this from in a piecemeal manner where we treat it as if we are doing vaccination for children, like when we take our kids to the vaccination clinics for measles vaccination. Oh, no, that will not work. I think we really have to be very deliberate in that mindset to say that we have to respect certain structures that have been put in place now and that are temporary to fight this pandemic. And then if the pandemic is over, we will look at how to normalize it. But now we are not operating in normal times. With respect to Tanzania, let me rather focus on what we are doing. We have webinars that started yesterday on vaccine literacy campaign, and they will continue. Some of those sessions will continue today, and we will be working with several outlets to continue to make sure that the accurate information is out there. And you see that in the coming days that you get a lot of feel our presence in the media, both social media and the mainstream. We just conducted a trial, a study, which we announced and shared with you all last year with regards to vaccine perception. The next step is to take the outcome of that study and then begin to tease out the different interventions. And one of those is really targeting community mobilization, vaccine literacy, managing misinformation, scanning and listening to what people are saying with respect to the effectiveness or not of vaccines and the very fake news that is out there concerning vaccines. I'll leave it at that. But it's just saying that we have about 20-something vaccines that we all have used at some point in our life collectively, a combination or not. And it is thanks to those vaccines that most people, including myself, are alive. I believe if I didn't get all those batteries of vaccines early on in childhood and some in adulthood, I probably would not have been alive today. So again, I'll leave the Tanzania piece to Tanzania, but I'll just end there by saying that Tanzania is a very important country. It's a part of the African Union Commission. Very like other countries, very with their voice matters. And I think at this point, what we should be doing as a continent is really promoting that unity, that sense of purpose. The sense of purpose that speaks to our founding fathers that really preach the concept of unity, the Haile Selassies, the Kwame Nkrumahs, the Nelson Mandelas, the Julius Nyereres, all said, if we do not unite in our actions, then we would be doomed as a continent. And the pandemic is a test of that unity of purpose, that no country should actually go out of that mainstream. We should see this virus as a common enemy and use the principles, the founding principles of the African Union and the African, which started as the African Organization of African Unity to advance this cause. If we do not fight this as a collective of a continent, we will be doomed. I think as a public health expert, throwing out numbers without a strong assumption will be misleading. And because it all depends on two major factors. One is the timeliness of access to the vaccines to the country. So as I indicated, if countries will go into the platform and place their orders, then we can now transport the vaccines and ship them to the countries. So that is one variable that is not under our control now. The second variable is that are the countries going, how quickly the countries will ramp up vaccination, okay? And then build into that second part is the cooperation and collaboration of the community. Is the community going to assist and facilitate that? Remember, I've always said we will never win this battle except the community is fully mobilized. Community here means all of us. We have to participate. So if all of those factors are put in place there, then you can, at least in the coming months, we'll be able to see how these parameters are being put in place. That is, i.e., the preparedness piece and the rollout and the access to vaccines. You can actually put 5 million doses of vaccines here in Addis Ababa, but if you cannot roll that out quickly, then of course it doesn't help your case. So I think give us time. Let's see how the first wave of the vaccines will be introduced in the coming weeks, and then we'll learn from it, and then we can make a very informed projections as to how many people we think we can vaccinate by the end of this year.
Thank you.
Hello, good morning. I have two questions, and it is how the in September 2019, like as a vaccine program.
So well, let me just say that the COVID-19 has impacted all our health programs, not just HIV. It has impacted our immunization programs. It has impacted our TB programs, the malaria programs, and HIV programs. I think once you restrict the movement of disease detectives or disease fighters, then you expect that there will be that will suffer. We are in the process of conducting studies now to evaluate the impact of COVID-19 in several components of our public health interventions, including maternal-child health and gender issues, and also, of course, HIV and TB programs. At this point, I can only say that, answer it very broadly, that I expect that there will be a lot of effect on that. If you recall that our program, when we launched our strategy, it was based on 3 pillars. One was to limit transmission and prevention. Second was to limit deaths. And third was to limit harm. And we defined harm at that point very broadly. The harm was defined to include the harm that COVID-19 would potentially cause on non-COVID infections, including HIV, TB, and malaria, and of course the harm to our economy. So again, these definitions were done since February. So we knew and had anticipated that there will be harm to our different programs. The second part of the program, I think a question I think I answered it very more broadly. So the conditions for countries to access the vaccines through the platform, again, here I'm being very specific to the AVAC, which is the African Vaccine Acquisition Task Team, are very clear. We have sent them note reverse, and the required forms also been included. Again, encourage your respective countries' leadership to go to the platform and do the needful. I think that is all countries now know how to go to the platform, and they have their code to access the platform. The African countries do manufacture vaccines, not necessarily COVID vaccine. You're probably aware that there's the Institute Pasteur in Senegal that manufactures yellow fever vaccines. There's also vaccine sites in manufacturing sites in Egypt, and I believe South Africa might be missing out some other countries, but not necessarily COVID vaccines, for sure. There is a need to strengthen that capacity as part of our health security apparatus on the continent. There are three key things that you need to guarantee your health security in terms of emerging diseases. One is the ability to manufacture vaccines. The second is the ability to diagnose, produce diagnostics. And thirdly, the ability to manufacture drugs. If you miss any of the three, then you are stuck with the ability to fight effectively against any pandemic. That is why we do not have, we're still living with the HIV issue. We've lived with HIV for 40 years. And HIV, if you know, if you recall, meets two requirements. One is that they are diagnostics. The second is they have treatment, but there is no vaccine. Then continue to see that almost 500,000 Africans die each year because of HIV, because there is no vaccine. So you need those three elements. I say this to highlight the point that as a continent, I hear you, and that is what we are putting forward to the leadership, that we must begin to focus on a new public health order for our continent. That means local manufacturing of those elements that you just highlight. Without that, our continent will be continue to be challenged for its health security needs. Yes, most of those vaccines that we indicated from the AstraZeneca will be produced and supplied through the Serum Institute in India, which is an affiliate of the Oxford Group. They have been licensed to produce those vaccines with the same quality vaccines as those produced at Oxford. We've also been discussing with the Russians. Where we are is that we have signed a confidential agreement to non-disclosure agreement, which will enable them to send us the data on their Sputnik 5 vaccine. We will review that, their dossiers, once they send it to us. We've done our part, we've signed it, sent it to them. We have also reached out to the Chinese manufacturers through the appropriate channels to request that we work more directly with them. So I think we're including the Cubans. We've also reached out to the Cubans, and I believe we have also a non-disclosure agreement to sign with them and to see the details of the vaccine. So we are very open to any party or partner that has an effective vaccine. All we want to see is two things: is the vaccine, has the vaccine been safely tried with results that speaks to the safety. Second is the vaccine efficacious. If those two parameters are met, then we are all up for it. Thank you very much. So it is difficult to say which countries will be receiving them. I mean, it's all, again, based on a simple objective formula. Countries go to the platform and then do the needful, fill in the right forms, and then their vaccines will be supplied. I've now seen line or in the media, internet, that I think that in the next couple of weeks that South Africa, through their own bilateral arrangements will be receiving some vaccines, I believe, in the next week or so. I don't know. I can't speak to that. I can only speak to what we are doing as part of AVAC, which can be simplified in terms of countries go to the platform, put in their requests, and it will escalate a process where the Afro-Exim Bank will get in there, they negotiate, they agree, and then the bank will pay the vaccine companies, and then the shipment will be arranged and shipped to them immediately. So I cannot control those parameters, so it's difficult to say to determine when countries will put in their requests, how the arrangements will be done bilaterally with them, with the Afro-Exim Bank, and when the shipment will occur.
Have come to the conclusion of our
We'll
briefing.
take 5 seconds.
I will allow you for today, but for next time, when we close, I think really we should be closing. So please go ahead.
Yes, so I wanted to clarify, you said 400 million doses through the Serum Institute that you're going to secure through this year. And then the 270, this is through AVAC?
So the 400 million doses through the Serum Institute will span from this year to next year. It's all part of AVAC. Okay, so AVAC had announced that through President Ramaphosa that we had secured 270 million doses of vaccines just 2 weeks ago. So these additional doses of vaccines will be in addition to that. So it will be 270 plus 400 million doses of vaccines. Again, remember, this is spread over this year and to next.
Thank you very much, Dr. John, for taking all those questions that we had for you today. And thank you, colleagues, for coming to us on the different platforms, the WhatsApp, live, and also on the Q&A. Now, let me give Dr. John the last few minutes to just sum up his main headline takeaway points for today.
So I just have one point for as a takeaway. One is really the strong recognition of the very goodwill gesture made yesterday and announced by the President of South Africa, the chair of our union, that the MTN has committed $25 million to supporting the acquisition for vaccines to immunize healthcare workers. I think that gesture is very, very important. It will enable us to start vaccinating our healthcare workers, but it also is an appeal to other private sectors on the continent to join that movement. Movement has started, a movement that says that if we vaccinate and protect our healthcare workers, we are protecting ourselves and we are protecting our economies, because they will bear they are currently bearing a huge brunt of the second wave of the pandemic, which we discussed here today extensively. Built into that, and my last message is that preparedness is a collective responsibility. I mean, no one should should feel like they cannot contribute in a preparedness component of this. This exercise is going to be a historic exercise. It's going to be unprecedented on the continent. We have never vaccinated more than 200 million people on the continent within a short period of time, say within 1 year or 2 years. I think it requires that the media work with us to engage the community and to continue to provide accurate information and then blunt off the negative information and fake information. So again, preparedness is a collective responsibility. We should all be spreading the right information, promoting that, and promoting the advances that we are making to secure vaccine to safeguard the health security and the economy of the country.
Thank you very much, Dr. John. I noticed that we had a question that came in a bit late from Della Russell, but Della, may I encourage you, please, to just continue talking to us through that same WhatsApp number so that we can respond to the issue that you have raised. But otherwise, thank you very much to all colleagues who have joined us. We are back on air with you again next week at the same time, and that is 11 a.m. East African time. But for now, from everybody behind the scenes, from Dr. John and from myself, thank you for having joined us, and have a great week.
Thank you. Thank you all.